Hello and welcome back. I'm Simon Howard and I'm a consultant in health protection here at the North East Health Protection Team. And this is the third of our videos of questions and answers for North East schools on managing COVID-19. And if you'd like to see our other questions and answers videos and our original webinar, please look at the links below. This third video concentrates on questions we've received about testing. So the first one of these, let's have a look. What happens if symptomatic children are unable to access testing? So children who are interested in the symptoms we're talking about are people who have a new continuous cough, a fever, and or a change in sense of taste and or smell. And if children are in that situation and are unable to access testing, the first thing to do is do everything you can to help them get testing, because that makes this all so much easier. So schools have a small number of kits and think about using one of those in this kind of situation. Encourage them to keep trying if they're trying to access testing through NHS 119 or the website, and do everything you can to encourage them to get tested. If we end up in a situation where there's absolutely no test available, then what needs to happen is, of course, the child needs to be excluded from school, as does their whole household. The household needs to isolate, the case needs to isolate for 10 days from the onset of their symptoms, the household for 14 days from the onset of the case's symptoms. And in terms of considering what you do with other school children, it depends whether we treat this as a confirmed case or whether we assume it's not a confirmed case, and we need a bit of a detailed risk assessment for that. And I would suggest contacting your local authority who can guide you through this. There are rules of thumb we use to help us assess the likelihood of a case, but they change frequently as the picture in the population changes. So it's always important to ask in these situations. So the answer is, if you're unable to access testing, do everything you can to access testing, make sure the case is excluded, and call your local authority for some further guidance. Next question is, can schools ask for evidence of negative tests? The Department for Education guidance is very clear on this. Schools should not request evidence of negative tests or other medical evidence before bringing children back into school. So the answer is no. And that's all the questions we have on testing, just those two. Got off lightly there. Thank you for watching. If you want to see the other questions and answers videos or the original webinar, links are below. Thank you. Bye-bye.